Hello, my name is John. I am a recent patient here at Irving Family Dental, and I will tell you right off, I'm not a big fan of dentist offices. In fact, before I came here, it had been nearly 20 years between my dentist visits, and as a result, my teeth were in really bad shape. I had lost some crowns that had gone, and then the underlying teeth had begun to decay even further. I had some that were cavities and things that had kind of taken hold, and my mouth was a mess. And so I began to search online, and interestingly, about the same time I began to get things on the internet that said, hey, one day dental implants replace kind of the whole mouth in a day. It did not seem possible to me, but certainly it got my interest. So I began kind of searching, and this office and one other kind of kept rising to the surface, to the top. And I searched on rankings, I searched on time, how long had they been in business, and I searched on kind of testimonials that people had. And this office and one other near me kind of rose to the surface. So I called both, and this office was the first one to respond and get me in for just a consultation. And I came in one afternoon. Dr. Doshi, whom I'm a huge fan of, he was the one that actually sat me down in the chair. I actually had a set of x-rays done, which was non-invasive, easy to do, and then he sat me down. We put my x-rays up on the screen, and he just talked to me. And I'll be honest with you, I was embarrassed to be here in the situation that I was in. I was nervous as hell, and I told him that I was nervous. And he's got a very kind of calm demeanor. He did not make me feel like, a bad person for not having taken care of my teeth as I should. He did not make me feel embarrassed, and I was embarrassed to be here, to be quite frank. But he walked me through my options. He said, we've got this set of options. I think in the grand scheme of things, there are maybe 5 or 6 things that we talked about, and we kind of isolated in on one. And he asked me about the timing, and I was getting ready to propose, and I needed a good set of teeth to propose. And so we talked about the date that I was going to go out of town, and we worked things out. And he and his team came in on a Saturday, which I gather is not terribly normal. And I got in the chair, and I had asked not to be awake for this, and so we did some anesthesia, and it was a relatively not painless, but it was a relatively calm procedure. And I will tell you, I would not really wish this procedure on anybody, but if you have to do it, I would absolutely tell you to do it here. He was very good about holding my hand through the process, and I text him if I need anything, or if I'm concerned about anything, if I've got any questions. He was very good about that. His team here is quite good, and I will tell you, even though the office is in kind of an older strip mall, the strip mall doesn't look great from the outside, but once you were inside the office, and I don't know a lot about technology, but at every step I've been kind of amazed at the equipment that has been here, both from scanning the x-rays to I ended up getting a night guard to help me because I grind my teeth at night. And the night guard, back in the day when I was a kid and playing football, you actually heated up the mouth guard and you sunk your teeth into it, and that's how you got a mouth guard. But they take a little wand and just kind of wand in and around your teeth. It doesn't hurt, and somehow that connects with the computer, and the mouth guard ended up fitting just perfectly. I still don't really even understand the technology, but it was quite good. So if I had to balance back, I would say this is a team that cares about their patients, and it is a team that will help you get over both the kind of the embarrassment piece and the fear piece. And I was quite honest, I was very, very nervous. And they helped me through that. We got through the procedure. I'm now in the kind of in the recovery. I still got some stitches, and you can probably hear me lisping a little bit. You have to get used to the prosthetic. It's different, but I'm getting better and better every day. And I come in on Friday. Today's Tuesday. I come in on Friday, and we're going to take the stitches out. And then in about I'm going to guess 4 to 6 months, Dr. Doshi says, these teeth, which are kind of temporary, will come out, and then the new prosthetic, the long-term prosthetic, will come in. And so we'll do that on Friday. That's my story.